Welcome to the Migraine Miracle Moment. I'm your host, Dr. Josh Turknett. I'm a neurologist, migraine specialist, migraine sufferer, and author of the book, The Migraine Miracle. In this podcast, you'll learn all about how to find your path to migraine freedom without pills. Let's get started. Howdy, Beast Slayers. It is time for another Ask Dr. D segment. This is where we pull out a question from a prior clinic chat to answer here on the podcast. And Jenny, what is the question for today?
Okay, the question says, I was wondering about the definition of headache in the phases chart. I get migraines as well as what seem to be more mild tension headaches, though they are usually only on one side, so maybe these are still considered migraines?
Okay, so first of all, she's talking about the phases, for those who might be unfamiliar with that. That is the phases that we created on the timeline of Migraine Freedom. So one of the things, and this is in a prior podcast too, but one of the things that became clear when people started implementing the Migraine Miracle program is that there was a progression that almost everybody seemed to follow through, kind of like the developmental stages of childhood, where there was a stepwise progression in terms of their improvement from wherever they were to Migrai-Neverland, and divided those into the 4 phases. And so there's a questionnaire that we've created, and you can find that over at mymigrainemiracle.com/phases if you want to take that, and it tells you where you are on the timeline. So anyways, her question relates to answering those questions in terms of like what type of headache counts as a migraine, right? And this is a great question because there's so much confusion about this issue. A lot of it that stems from the fact that a lot of these various headache types, some of which are used in medical clinics, some of which have just been created by sort of the lay public, aren't really based on any kind of objective standard, but rather in kind of nebulous and often very subjective criteria. Some are defined better than others, but we've ended up with this kind of hodgepodge of terminology that isn't used very consistently. And I think most of the time these various labels confuse more than they clarify. So I always advocate for using a much simpler approach, and I'll tell you kind of the simpler approach that I use. It's much more practically valuable than all of the various different labels that we've created over the years. So the first, and in my opinion, most important question that we consider when we're addressing any headache or thinking about any headache is whether it's the result of some kind of injury or insult inside the cranium or inside the skull, which has then activated the part of the brain that results in the sensation of head pain, or whether it is the result of the pain centers in the brain being turned on without any kind of injury to the cranium. So the first category, which is head pain that comes from an injury or insult to the head, is the brain's pain sensing system working like it's supposed to. So just like pain anywhere else is supposed to tell you that something has gone wrong inside your body, in this case inside your head, that you need to know about, whether it's bleeding or an infection or inflammation or swelling or a knife or whatever, so that you can do something about it, right? That's the whole reason we have pain. And then the second category is head pain in the absence of any injury or insult. And this is essentially the brain's pain-sensing machinery malfunctioning. And these are what we'd call primary headache disorders. The others we would call secondary headache disorders because there's pain that's secondary to something else. In this case, the pain itself is primary. And primary headache disorders in this day and age represent the vast majority of the headaches that people have. Which probably wasn't at all true for our hunting and gathering ancestors. These were probably very uncommon, and almost all of their headaches were secondary headaches from actual trauma or other type of injury. In fact, the very fact that the majority of modern human head pain is from a malfunction in our pain system is one of the telltale signs that we're exposing our brain to an environment that it wasn't designed for. So in this category of primary headaches are migraines, of course, and then other things like cluster headaches and we might throw tension headaches and a few less common variations on that. But you could make a very good argument that we'd be better off just referring to all of these as primary headaches. And that, I think, is certainly true of tension headaches. So at one point in time, this whole label of tension headache was created because it was thought that those headaches were caused by excessive muscle tension in the neck and shoulders. However, there actually isn't any evidence to support that idea, and there's evidence to refute it. So if you actually stick a needle EMG to record muscle activity in the neck and shoulders of someone who's experiencing a tension headache, you're not going to find activity there. But this terminology, tension headache, still remains. And so many people have this association with tension headache, meaning it's muscle tension, which also gives the impression that it's maybe a secondary condition, right? It's secondary to muscle tension, when it's much better thought of as a primary headache disorder being generated by the brain sensing structures. What we call migraine is really, as we've talked about before, a group of related physiological changes in the brain that tend to occur together. So it's a multi-headed beast. So you have the prodrome, the various kinds of auras, all different kinds of pain, and the pain can vary in its location and its character. Then you have things like nausea, light and sound sensitivity. So all of these different symptoms that can be experienced and can cause, essentially, every migraine is unique, right? Because there's so many different variables that are combining together in any individual expression of a migraine. And these all arise from different parts of the brain being activated during the migraine. So in a full-blown classic migraine with every symptom, kind of all of these different parts are turned on in this whole process. But we know that in many instances of migraines, some parts can get turned on without others. And so this leads to, again, migraine coming in many, many different forms. And in my view, the majority of what is labeled as tension headaches are just one of the many different heads of migraine. One of many types of the character of head pain that can be activated as part of the migraine process. And so as a general rule, with rare exception, any type of head pain that occurs in someone known to have migraines that's not caused by injury or insult in the cranium should be considered migraine. Right, for practical purposes. There's no real reason to label it as something else. It doesn't. It ends up, the problem with labeling it as different things is people end up chasing the wrong thing, thinking that, so for the example of tension, thinking that the solution is somehow to reduce muscle tension, right? Mm-hmm. Rather than it's all coming from this same underlying root cause, and regardless of how it's expressed, again, we have limitless numbers of ways it can be expressed. If we choose a different label for all of that, it gives the illusion that we need a different treatment for all of those things. And this is one of the fundamental problems with how people think about migraines and how they're taken care of, both amongst the lay public, but also even in the clinics. If you understand that it's all emanating from the same root cause, and then it's just whatever pathway it goes down happens to be the way it's experienced by a person, you realize that it's ultimately about addressing that root cause. And that's what people in the program see. Everybody who comes in, they have their own unique story, right? Their own unique ways in which their migraines present, whether it's labeled as vestibular migraine, whether it's labeled as hormonal migraines, whether it's barometric pressure migraines, all of these different labels, right. They're all fundamentally coming from the same underlying physiology. And these labels are unhelpful in terms of because they steer people down the wrong path. So they're, maybe useful from an academic standpoint, just if you want to classify things, but they're not practically useful in my opinion.
And one of the things that you've always said that resonated with me is that once that migraine switch is flipped, no matter what flipped that switch, what the initial trigger was, then it's the same, way to approach it.
Right. That's right. It's right. Ultimately, we're trying to figure out how to keep the switch from being flipped on.
Right.
But once it's flipped, it may look very different from one person to the next. And the last thing to add is that another thing that's often misdiagnosed as tension is rebound headache. So, I think that there's good evidence that rebound headaches are rooted in kind of a low-grade inflammation in the meninges, or the tissues that cover the brain. And that tends to result, at least one of the pain types, is this kind of more diffuse skull pain that happens. And I see that very often, people referring to that as their tension headaches. And that's one of the telltale signs of rebound, when those are occurring on a regular basis. And again, it oftentimes leads to this search for, whatever it's massage or chiropractic or, some muscle relaxers, more medications, it just leads to this label of tension on that is just, it's thought to indicate what the root cause is. So it leads people down paths that are either unproductive or even counterproductive.
So I had a point of clarification question here for you. That is a common question inside Migrai-Neverland. People will say, okay, 6 months ago I had a concussion or some kind of head trauma. So now how do they distinguish that from the initial trauma versus a primary headache?
Right. So good question. That's a big can of worms.
Yeah.
But that's a common issue for any person who deals with people with headaches, and I've taken care of a lot of folks with this. And so based on that experience, I would say that the vast majority of folks who are still having any type of pain at that point in time, after an injury, it's almost always secondary, and meaning it's no longer from the initial injury. It's from some other thing that has happened because of it. Sort of that was the initial event. Reminds me of that book, What Got You Here Won't Get You There, or whatever. But it's like the thing that people often look to address the thing that started it, and you got to look at what's causing it right now. So there's a tendency to think it was the trauma, maybe that was the lead domino, but you're way down the chain now, and there's other, so that trauma has no longer become the thing to address. By and large, when I see that, it's almost always rebound.
Right. Gotcha.
And you think about any type of injury, right? You sprain an ankle, you even break a bone, right? What's the typical time course? Usually 2 to 6 weeks, 8 weeks maybe for a really severe injury. If you're going longer than that, you're no longer dealing with tissue trauma, right? That's all resolved. Like the initial injury has long healed, recovered, and so if you're still having pain that far out, like I said, it's almost always rebound, because this is not something that most providers, certainly anybody outside the field of neurology, is aware of. So people just get shoved with a bunch of pain medications, and then that starts the cycle. And then there's this thought that, that I've had this trauma, it's going to just be with me and I have to deal with it, when people don't realize the reality that it's actually the medications that are continuing it. So, I've been able to help tons of people over the years with this, simply by saying, look, hey, this is actually from the medications. We can stop this. And in almost all the cases, it works. So that's what I'd say about trauma. It's if it's that far beyond, then it's time to start looking for other things.
Right.
And it can even be, someone starts having migraines. That can be that can be a trigger, right? And it may lead to other things. Head trauma. Then you start not sleeping as well.
Right.
May change your other routines, whatever. But you may have your first migraine, and now you're dealing with migraines. But you're still, like we've talked about before, then it becomes, what are the root causes that we know about migraines? It's no longer, we're not, it's the trauma is done, it's in the past, we have to deal with what we've got in front of us, which is now just a case of migraine. Just so happened that was the path that led to it.
Right.
But you're still dealing with the same fundamental issue.
Right.
So again, it's so common to get led astray by these labels that we put on things. There's another case of that. So a complex topic, but hopefully that's helpful for folks. And if we can, at the minimum, get some clarity, and maybe even eliminate the term tension headache from people's vocabulary,
right?
That would be a victory in my book.
So that was from Chatter issue number 10 for our members who want to go into the archives and read more on that topic. And then do you want to read the other topics discussed in that chat?
Yeah, I've got it in front of me. So one is the relationship between inflammation and rebound headaches, what medications can cause rebound headaches besides triptans, and the headache relief medications everyone should avoid.
Some big topics.
Some big topics, right? Kind of on a theme. All right, so that is issue number, you said 10?
I believe it was 10.
So members can find that in the archive. And if you want to have access to that entire archive of how many issues?
I don't know.
150 or something?
Yeah, something like that.
They're a lot. Along with all of the other resources inside of Migraine Neverland. We'd love to have you as part of the community. Just go to mymigrainemiracle.com/join. And that is it for this episode. So now it's time to go out and slay the beast.